Welcome back, and we welcome Sam Harris to our program. Sam is the oncology patient advocate for Erlanger's Cancer Center, and he's going to talk about the patient advocate program as well as support groups. Erlanger's patient advocate offers patient-focused, family-centered support to help patients and their loved ones through their diagnosis, treatment, and family issues, and provides emotional and spiritual support and reassurances as well. Matter of fact, you've been on here before, and we've talked about what is called the man-to-man program.
Yeah, we talked about man-to-man as well as Kids Count.
Yeah. So today we're going to talk about what?
Well, our Kids Count program continues to grow. It's a nationally recognized program now. CNN did a special on it last year, and then we've been featured. I may have showed you this last year. It's a book called Helping Children, and we've got a chapter in there by Peter Vandernook. This is the Lance Armstrong edition of this particular, and because our program is rather unique, being that we go into the schools for our program. So it's been exciting. We worked about 75 children last year with the Kids Count program, plus we've had to expand it a little bit too, because we also have children who lose their parents or grandparents, so we do a Kids Count grief style program as well. So it's been a very successful program, been going for about 7 years now.
Oh, that is very good, very good. In all, how many? Well, let me back up a minute. First, how important are support groups? Very
important, because as you well know, cancer really impacts the family, the whole family, children and loved ones as well. So we try to do as much as we can. For instance, in our man-to-man group, which is our support group for prostate cancer, we'll be meeting tomorrow night, and we'll have almost 50 there, and we include the wives in this program. We feed them. We tell the wives they don't have to cook it or do dishes, and they come, and we offer many different types of programs to help them through the process of dealing with cancer. So it's a very vital thing, and it impacts our children, so they too are included in many of our support groups.
That's very good. Do they meet just once a month, or?
That particular one meets once a month. Our Kids Count program meets on every other Tuesday in our schools. And then we're working on starting a general support group as well for cancer patients. Also a glio brain support group as well. And so each one of those.
What's that?
Glioblastoma, there could be brain tumors. And so we're helping. We've got several patients who want us to start a support group for that. So we're in the process of working on that as well.
How many support groups and services like this do y'all offer?
We've got about 6 or 7 that are going now, and quite successfully, and we try to work with as many as we can. A lot of one-on-one work is done as well. A lot of times, especially children whose parents live in outlying areas who come in for treatment, they will come in and we will work with them because it's just too hard for them to get in on a regular basis. Matter of fact, just this past week, this past Tuesday, we had a couple of children who are homeschooled who joined one of our groups at Boyd Buchanan Elementary, and they were welcomed there. Their mom is dealing with cancer, so any way that we can help meet the needs of these families, that's what we want to do.
Well, you know, that's as important, I would think, from what you're saying, as the physicians treating the person, is to have somebody else treating the family, so to speak.
Well, we work together as a team, and the doctors will call on me to meet with the families, to deal with issues, and whether it be emotional or spiritual, or just help them to walk through the process, and that's what we're there for, because it's a team issue.
Well, Sam, how can people get in touch with you?
My office number is 778-5119.
5119.
Yeah, they can always contact me there, and I'm not in my office very often because I'm always out seeing patients, because I cover all of oncology, but they can leave a message and we certainly will follow through on it.
Good deal. Good to see you again.
Hey, it's good to be back again. Thank you for having us.
Now let's check in with Mr. Food. He's in the kitchen. Bright lights at the produce counter. Wow.